I'm Mary Pepino, and welcome to Fit for You, the show that teaches you how to live a healthier and more fit lifestyle. Today, I'm on the campus of Youngstown State University in the athletic training program room, as you can see behind me. YSU is one of the first to bring a master's in athletic training to a university. It's a very interesting and exciting show. We've got some amazing guests, and one of the most amazing, we'll be spending some time with President Jim Tressel. I hope you enjoy. We are here in YSU's training room, and I'm so honored that we have the privilege of being in here with my dear friend, Dr. Jen Pintar. Welcome again, Jen, to Fit for You. Tell us a little bit about your journey, how you ended up here at YSU, and what your background is.
Sure. Well, I started off as a biology major for undergrad, and I was a competitive swimmer as well. And one of my professors encouraged me to go the exercise science route. Really didn't know what exercise science was, so it was a big experience for me, but I applied to grad school anyway, and learned how much I really enjoyed working with the human body and trying to improve performance, both at the athletic level but also with clinical populations.
And when I first met you, you were not chair of the department a few years ago, so you came in as a professor.
Well, yes, I came in as an assistant professor and went up through the ranks. I've been at YSU now since 1999, so I'm starting my 18th year here, and I became the chair of the department about 2 years ago.
Fantastic. And as you know, and as I've said many times, thanks to our friend and amazing leader,
Yes.
Coach President Tressel,
Right.
you have been able to bring your idea to fruition, which is, tell us about what you've created here.
Sure. The amazing support of President Tressel, Dean Mosca, and all the faculty members in the department has allowed us to bring something that's very exciting for not only Youngstown State but the community at large, and that is the Masters of Athletic Training program. And with this Masters of Athletic Training program, students will be able to work right upon graduation into the field of athletic training, both at schools, competitive athletic associations, and then also things you don't think of typically, like dance studios and musicians. So it's a wide variety of potential jobs for these students.
As we get further into the show and I talk to some of the fantastic people you've brought on board to actually execute this vision, we'll get more into the detail. But what does it take to actually create something like this? Because I know it was a huge undertaking, and you are one of the only in the state of Ohio, correct?
That's right. We are the second entry-level master's degree program for athletic training, so it's a huge success for Youngstown and for this part of Ohio. It started with a consistent need from the community. We were getting phone calls after phone call asking for athletic trainers, and there's really a dearth in the community, and there's a need for athletic trainers. So we went ahead and explored that desire with our students. We knew there was a community need, but was there a desire among the students? So when we surveyed our students, we had over 200 of our majors that responded that this was exactly what they wanted to do, some sort of graduate work in exercise science, and Masters of Athletic Training was the perfect choice for them. So we started the program proposal, and you can't just put any program into a university. There's this long process for it, and it took us about 2 years to get the program instituted here. And it begins with just presentations at the university level, but it goes all the way to presenting at Columbus. And you sit down with the Board of Regents, which is a group of representatives from each and every Ohio college and university that's affiliated with the Board of Regents, and they have to vote. And they look at the worthiness of the program and whether the job outlook looks like it's there, and they decide yes or no. And then the chancellor approves it, and it goes through a lot of channels to get the program instituted.
Now, this is the first semester. You literally had the first class starting last week, if I remember.
Week. That's right.
And how many are in the program?
So we have 8 graduate students in the program, and we have 5 graduate assistants. So it's a nice size program of 13 new additions to Youngstown State graduate program. And the great thing is that a lot of our graduate assistants, they came from across the country, so they're not local. We're bringing
Not all are local.
Right.
Some are.
Some are. All of our graduate students are. But most of our graduate assistants are from across the country. So it's nice to get other states involved at Youngstown State.
And tell us, what are the undergrad majors, if someone is looking at doing something like this, that you would recommend they go into prior to?
I think the best, well, I'm a little partial, but I think the best degree is exercise science, for sure. We talk a lot about human movement, we talk a lot about the body, injury prevention, restorative care after an injury, and it lends itself very well to athletic training.
I'm very excited to talk to some of the people, because as I was preparing for this show, it was amazing how many areas athletic training really touches, and what it's all about. And we'll get to that now that we meet some of the people. Thank you so much. It's exciting.
Very.
It is with great honor I introduce to you my friend and the president of Youngstown State University, Coach President Jim Tressel. There are a few guests I've never really been intimidated. I'm always well prepared. I am intimidated right now, so I'm turning it over to you.
Well, this is, low level compared to Bob Mansfield. And so I know you've had Bob Mansfield on your show.
Yes.
And I'm just honored to have been on the same show that he's been on, and Dr. Jen Pintar. I mean, I'm with High Cotton here.
Oh, and believe they will be so honored that you even mentioned their names, but thank you. President Tressel, because of you, so many amazing, wonderful things are happening here at YSU, and it truly is your influence. This Masters of Athletic Training, especially with your love, appreciation, and expertise in sports, tell us why you think it's so important to our YSU community and to our community as a whole.
Well, it's really been the passion of Jen Pintar and her faculty. Getting Jessica in here to take over the program and do something that's so needed. All of our middle schools, high schools, club teams, universities, professional teams, they count on their trainer. I mean, the trainer may be as important or more important than anyone on your staff. They form a bond with the student athletes, with the professional athletes, with the patients in general, and give them confidence, give them hope that they're going to feel better, give them hope that they're going to perform better. They study the science of it all. They give great advice. They work crazy hours. I mean, to be a trainer, you have to be dedicated and compassionate, toward your students. So we're proud to have this program. It's about time. We needed to have this program a long time ago, and I'm glad that Jen kind of took the bull by the horns with Dean Mosca and his college and have gotten this going.
It's fantastic. As I was preparing for this segment, I always thought of an athletic trainer as being part of a sports team only, and the tentacles reach far beyond. I understand it's in the police, it's in the military, it's in people who dance, it's in people that are in music. So it's going to be a far-reaching scope of the graduates of this program.
I think one of the biggest industries now and in the future is the healthcare industry. And most especially the sports injury, the sports prevention. As much of what they do is they talk to their athletes and the people that they serve about, what's it going to take to prevent injuries, overuse syndromes, all the different things. They're great mentors. They do a great job of letting the person know the limits of their body, the difficulties that can happen if you don't train the right way. Then obviously when the things happen, they're the ones there on those tough moments to let them know that, we've got this, we're going to get this back in shape, and you're going to be back on the court or back on the dance floor or back in the firehouse or back on the police run or whatever. And so, huge industry, and it's great that we're going to be a part of it.
What can we do as a community to support the efforts of this program?
I think the more we can do like we're doing here is to let people know the opportunities in this field, the difficulty and the training they go through. This master's in athletic training is not going to be an easy route. These folks have to know everything. They have to know every bit of what a doctor knows and a nurse knows and a nurse practitioner knows. I mean, they have to be really well educated, and there's exciting opportunities for young people that want to think about this, that health means something to them. Sports activity means something to them. So I think the more we can get the word out that this opportunity is here and that we want to turn out countless folks who are going to go in a million different directions, that opportunity is here, and come and find out about it.
Well, I have the honor of having your presence here quickly. You've created so much here. Any other advice you want to give, or any other comments about other things we can be doing, not just to support this program, but to support your efforts to make YSU the #1 university in
the world.
In the world. I love it.
That's
I wasn't
right.
sure where you were going to go with that.
Right. Well, I think helping people understand just the breadth of what our faculty does. They're involved in research that may be life-changing. They're involved in so much community service. They're involved in training their students. They're involved in teaching the disciplines. Understanding the importance of what our faculty does in all of our programs, whether it's this program or biology or the engineering fields or whatever it happens to be. It is really a blessing to have a university in a community. And the more we can get that message out, and the more people learn about what all goes on at a university, there hasn't been that much happen since I came. They've been working on these things for 100 years. I'm just their cheerleader. And it's fun to be on your show to cheerlead about this particular program. But we have a dedicated faculty who they want to be the experts in the fields they're in, and then make a difference in people's lives beyond, and proud to be associated with them.
Well, what I admire so much about you, and truly from the heart, you're in touch with everyone. You care about the students. It shows. You give a countless time and a lot of support. I know the enrollment is up significantly. I know new things are being created in many areas, and it truly is an honor to have you.
Well,
thank you.
We're here to serve those students, #1, but we're here to serve everyone that works at the university, #2, and the university is here to serve the region. And if we can all serve one another, lots of good things are going to happen.
You're an amazing leader and a friend. Thank you so much. Thank you.
Thank you.
Dr. Pintar did a search when she was ready to execute this program, and the person selected was Dr. Jessica Wallace.
Yep.
Welcome, Jessica.
Thank you.
And interesting background, born and raised in Naples, Florida.
Yep, native
Usually
Floridian.
people are doing this. They're going from here to Naples. You're coming from Naples to Youngstown.
I did the complete opposite, I know. Born and raised in the sunshine, but I tell everybody the reason I'm here is I really love seasons. I like the change in weather and temperature. I've never had that growing up, so I really am excited about that.
You're in the right place.
Yeah.
And in the dead of winter, if you want to sneak away for, a long weekend, you can always go back home
Just
for,
call Mom and
if you're-
Dad.
Right. It's the perfect solution.
Yeah. Yep.
Tell us about your background. You started out, I believe, at the University of Miami in Florida.
Yep, so I did my undergraduate degree in athletic training at the University of Miami down in Florida, and I actually went to school and didn't know I wanted to do athletic training. I knew I wanted to do something in sports medicine, and I had a really great academic advisor that kind of said, hey, why don't you give this a shot and see if you like it, and I fell in love with it in my first athletic training class, and that's how I got into it.
Were you in sports in high school at all?
Yes, I was
and
actually
college?
a softball player all growing up.
Okay.
Yep.
It's usually some type of sport that gets people somewhat interested in saying, okay, I want to major in some type of sports. Did you have any injuries when you were playing?
I actually didn't really have any traumatic injuries. I had some chronic overuse injuries. I was a pitcher. And so, I had some tendonitis in my shoulder, and I did work with my high school athletic trainer. And so that's how I really got exposed to athletic training and knew I wanted to do something in that area.
From U of M, you went on to University of Central Florida?
Correct, in Orlando. So
I got your master's in PE, physical education?
Yep, so I worked as a graduate assistant athletic trainer at University of Central Florida, and then I got a master's in physical education.
And you got your master's same place?
I got my PhD at Michigan State. But
So
my
your master's, was at University of Central, and then your PhD,
yes,
Michigan
was
State.
at Michigan State University.
Concussions were a little bit of a passion of yours, if I recall?
Yeah, so actually in between my master's and my PhD, I worked as a high school athletic trainer and a high school PE teacher. And so I really saw a lot with concussions, and I saw the need for really good research at the concussion or in the high school age group. So I decided to pursue a PhD, and that's my line of research now, is all sport-related concussion in the high school age population.
So then you got recruited, and in 2016 you joined the team here, correct?
Yep, started last fall, 2016, and I wasn't teaching any athletic training courses. I was teaching more exercise science courses, and really doing all the behind-the-scenes paperwork to get this program up and running. So last year was a lot of paperwork, a lot of planning. That way we could accept students and get the program up this fall.
Now you wrote the curriculum, if I recall.
Yeah, so I assisted in writing the curriculum. Our curriculum is somewhat standardized through our accrediting body. We work through a program or accrediting body called CATIE. And so they accredit and they kind of write standards as far as what type of education that students need to have throughout their athletic training education career. And so we were able to kind of plan our courses and write our courses, so we were meeting all the needs of our accrediting body. So the students got everything they needed in the 2 years.
Now, how many hours are in that 2 years of study?
So it's a 60 credit master's program. So it's actually a very large master's program. Most master's programs are anywhere from 33 to about 36 hours. However, this one, it's quite lengthy. They're able to do it over the course of 2 years. So they'll come in the fall, they'll do a fall, spring, summer, fall, spring. So
I'm assuming there is a percentage of hands-on, there's a percentage of study. What is the balance or the ratio, would you say, of how much the students are actually going to be focusing on hands-on practice?
Well, we really highly emphasize the hands-on practice. We provide them with the didactic classroom education through all of the coursework. However, to really be a great clinician in the field of athletic training, it takes hands-on experience. And they're only going to get that through exposure at their clinical settings. So we have it set up through our curriculum and our program that they will complete 4 clinical rotations. So each fall and spring of their 2 years, they will complete a program. And in that semester, they have to complete so many hours. And so it's really great because they'll get exposure to a lot of settings in athletic training. And so they will work with high school age students, college age students, maybe senior citizens, youth. So they're able to understand everything involved in the clinical setting.
I was very surprised, as I have stated. I never realized athletic trainers reached so many industries. NASA, NASCAR, like I've mentioned, music. Anything that has a beat, anything that uses the body, the military, law enforcement, firefighting, dancing.
Oh, yeah.
I mean, it seems like there isn't really a profession that has any type of physical activity associated with it that doesn't need some type of an athletic trainer affiliated.
Yeah, athletic trainers are in high demand in many industries. I've had former friends and colleagues work for companies like Delta Airlines. One was working for the Consumers Energy electric company in the state of Michigan for the electricians and other people working in industry. I've had friends working in Cirque du Soleil, in ballet. So I've had students work at Disney World with their characters. And so there's all different niches and avenues that students can pursue in athletic training. And that's why it's such a fun, up-and-coming, booming health profession, because there's so many opportunity and there's a need for athletic trainers in all different industries.
What is your goal, would you say, over the next, 1, 2, 3 year period?
Well, currently our program is not accredited. So if we think about CATIE and our accrediting body, we're not currently accredited because we're a brand new program. And so my focus over the course of the next year or two is really going to make sure that we complete our self-study and work on our accreditation. So
now you have to get started to part
pursue
of the
accreditation. Correct. So it's kind of like a double-edged sword. We're excited to start. We're not accredited, but we can't get accredited until we have students. And so it's a lot of work, a lot of groundwork, but for the students, it's all worth it.
And I'm very excited because I'm going to get to talk to a couple of the students now.
Yes.
And the students that I've met, just wonderful, amazing people. You know, and I keep using this word amazing, but it truly is, because I love everyone's individual story. I love everyone's contribution. I love the passion, and I love the passion and dedication of the students.
Yes.
And they all have a vision of where they're going,
Absolutely.
and everyone's going in a little different direction. So it's interesting.
Yeah. They're a great group. I tell everybody that I talk to when I go out to the community that they're really going to enjoy having our students in their clinical settings, because they're eager to learn, they're really motivated, and they're just a really great group to start with.
Well, thank you so much.
Thank you.
We're going to come back sometime in the future here, because we want to see how this is evolving, and then
Yeah,
look at the
absolutely.
progression.
Thank you for your time.
It's a pleasure. Thank you. I welcome back Ashlyn Myers. And Ashlyn, you were so kind to do the show the last time I was here. You were demoing some exercises. Welcome.
Thank you for having me.
And when we were here then, you were in your undergrad program,
Yes.
exercise science?
Yes.
And now you are in the new athletic training program.
I'm very excited.
Yeah, you're from an area around Toledo and came to YSU on, want to tell us how you ended up here?
I originally came as a preferred walk-on for the track team at YSU, so that was the main reason I came to YSU. And then I decided to be in exercise science because I knew coming into my undergraduate degree that I wanted to become an athletic trainer. So it's kind of just been that whole thing ever since.
Now, and you have a very interesting background, because you were somebody who got injured when you were how old?
Oh, I was probably about 16 or 17 when I had my first injury.
High school track?
Cross country.
Okay, and you spent a lot of time with an athletic trainer, right? Tell us
I
the
did.
journey.
So I unfortunately became injured my senior year of cross country. I lost the whole season, couldn't compete at state. I had an overuse injury called IT band friction syndrome, and I spent a lot of time with my high school athletic trainer doing rehab, and it kind of caused us to become very close. And I showed an interest in what she was doing in her profession as an athletic trainer, and she allowed me, because of our relationship that we built, to start working with her and some of the athletes she was helping rehab while I was still in high school. And that's just kind of where I started with it. And I worked football right before I graduated, and then I kind of came to YSU.
So while you've been at YSU, have you been able to do any what I will call type of athletic training,
Yes.
work through as you were an undergrad?
Yes, I received a lot more injuries after I came to YSU. Just kind of luck of the draw, it is what it is. And being in the atmosphere of not only being an injured athlete, I also received a job working as a student aide in the athletic training room for the last 3 years, and it's mostly with football. But I was able to then incorporate what I knew being injured myself into helping other athletes by the direction of JD and Jenna.
And I think bringing that experience will be so helpful
Yes.
to the people that you are, servicing when you actually become an athletic trainer.
It's two different perspectives, and they're both, they correlate with each other very well. So I have two really nice perspectives to help bring into me as a professional.
Well, good luck to you.
Thank you so much.
We'll look at seeing you again in a couple years and see how you're doing.
Thank you.
I mentioned that Dr. Pintar amassed an amazing team of people, and one of the people at the top is, I'm going to refer to you as Young because you pronounce your name so beautifully, I couldn't even begin to say it. Please tell us your full name.
All right, my full name is Yongung Kwon.
I love it.
Yeah.
But I can call you Young.
Young, yeah, that's
Thank
enough.
you. Young. PhD in?
Rehabilitation and movement science.
And your focus was biomechanical research.
That's right.
Tell us a little bit about how you ended up here at YSU.
All right, so I was so excited that when I heard YSU is creating the master program in athletic training for the first time this year, because it would mean that I would be able to contribute my experience and expertise to more than two existing programs.
Young, tell us about your studies, the subject matter, the content, beginning with your undergraduate work.
So I got my bachelor's degree in kinesiology in South Korea. And after graduating, I was introduced to athletic training program by my advisor, which was something that I really wanted to study
Now, this was in Korea.
in Korea.
Okay.
Then, but since there is no athletic training program in Korea, I came to the state and went to University of North Carolina at Greensboro to pursue my study. While I was working a certified athletic trainer, and I became curious about how to prevent injury more than the learning about treatment of injury, which led me to get a PhD in mechanism of lower extremity injury and biomechanical analysis of gait, running, and jumping from Virginia Commonwealth University.
And now, one of the goals, I think, is to, and you're leading the charge, create a research lab as part of this program, correct?
Yes, right. So YSU, we are currently creating a sports medicine research lab. As an athletic trainer and a biomechanist, it is my responsibility to create a lab that conduct research on athletic injury.
Now, what will your role be in the actual creation of the lab? And then once the lab is created, you will be, tell us about what you're going to be doing.
So the sports medicine research lab will focus on mechanism and risk factor and preventive solution about the musculoskeletal injury, with an emphasis on ankle and knee joint injuries. Further, the sports medicine research lab will conduct research in the area of the biomechanics to provide beneficial to students, including prevention of the musculoskeletal injury and performance enhancement.
I was very amazed at your interest, and apparently there's an ability and focus. It's not about just treating injury. Prevention is even more important and more of your focus, correct?
Yes, right.
I think that's amazing. 3D motion. You explained it to me in our preparation, but I want you to explain it to our audience. I am so fascinated by it.
So the sports medicine lab will have 3D motion capture system and the electromyographic system and the force plate. These equipment will analyze the human body movement and neuromuscular functions. So in the future, we can provide the athlete beneficial to analyze their motion from jumping from the basketball or rebounding or landing on the ground. And then we can analyze their 3D motion, and then we can also look at their muscle functions. So we can tell them what is abnormal, what is normal, so we can prevent to their injury.
So for example, if they're abnormal, I'll take me for example, because I have very flat feet, and I'm a runner, and I've always been challenged because I don't have much flexibility in my foot.
Yeah.
So you would be able to find out, and what some people might not realize is because I'm flat-footed and the way I come down, it's affecting my knee, my hip, my back.
That's correct.
So you would be able to say, okay, Mayor, analyze me on 3D, and it wouldn't just be getting, I mean, I have orthotics, but you would take it to a much, much, much higher level so that I don't have to be concerned about knee injury and hip injury and back injury and know how to keep me in alignment. And also, I'm assuming, maximize my performance.
Right. So like for example, if you are flat feet and if you don't have any flexibility under your feet, that means whenever you walk or whenever you're running, and then your knee or hip has a lot of pressure from the ground because you don't have any flexibility. So we can look at the 3D motion capture system to see how much your knee or hip is affected by your flex your feet. So we can tell them how much you actually need to flex your hip or knee regardless of your orthotic.
Amazing.
Also, we can put the EMG, which is to measure your neuromuscular function. So we can put some electrode on your hip muscle or thigh muscle or your lower leg muscle. So whenever you walk, and I can see which muscle you actually overacted or which muscle is you not activated.
Wow.
So I can tell you which muscle you need to strengthen in order to make good gait
Amazing. How will the students benefit from this program?
Right, so as I told you, the sports medicine research lab will have a 3D motion capture system and electromyographic and the force plate. One of the most important domain of the athletic training by the National Athletic Training Association are prevention, evaluation, and diagnosis of the injury. So this lab will analyze the human body movement, right? So this lab will help students to attain a comprehensive understanding of a biomechanical and neuromuscular assessment under sports simulated environment.
Wow.
Also, students will also have indirect practice about researching, so they will have more broader aspect to choose what they want to be in their future.
Very exciting stuff. I know we are going to actually see you in action. You know, what people sometimes think are simple things like wrapping and whatnot. At your level of expertise, there's a real difference because the way you do it can really prevent the injury, and if you don't do it right, it might not necessarily be effective, correct?
Yes, right. So for example, I don't want my student to just memorize these things, you know, so they want to know why people has an injury. So it's really important to know the reason in order to give them the appropriate treatment or rehabilitation.
Dr. Kwon, you are going to now explain how to treat a knee injury, correct?
That's right.
And it's impressive. It's almost like a little bit of a setting that the students will be going through because they're taking notes around us as they will be doing, and we have a student on the table as our model for if she actually had the injury.
Yes, right.
So I'm turning this over to you now as the expert.
All right, thanks.
Thank you.
Right, guys, today I'm going to show you guys two special tests for medial and lateral collateral ligament. If we assume this patient may have the medial or lateral collateral ligament injury, then we need to obtain these two special tests. So the first one, if we assume she may have the medial collateral ligament injury, then we need to apply valgus stress test. Okay, do you guys know the valgus and vellus, right? So basically, there is two categories. The first one, valgus stress test with full knee extension, which means I'm going to let her straight her knee, and then I'm going to just slowly lift her legs. Okay, then I'm going to grab her ankle, and then another my hands is going to be put on her lateral knee side. So I'm going to push this direction, and then another my hand is going to opposite direction that I'm going to push. Okay, so if she refer pain on her medial side, we can assume she might have the medial collateral ligament tear or medial capsule tear. Okay, and then another one is I'm going to make her knee at 20-degree knee flexions. Okay, this is a way better to isolate medial collateral ligament injury. Okay, then it's the same way to push as make the valgus, so she have more stress on her medial side, right? That's how we're gonna confirm she has more medial collateral ligament rather than medial capsule problem.
It's my pleasure to introduce to you Mr. Ryan Smith. And Ryan is one of the students that is on the ground floor of this amazing program. Welcome.
Hey, thank you for having me.
Ryan graduated from Hubbard High School, and tell us how you came to YSU.
You know, it's growing up right down the road, 10 minutes down the road. This was I wouldn't want to say a convenient spot, but it was always a school I've had in mind growing up. I wanted to come here to YSU. I've had family members come here, graduate from here. So I've always
and go on to be very successful.
Yeah, absolutely. Yeah. And so it's just been something that's been in my future. I've always thought about it growing up in middle school, high school. YSU was the destination for me. So
what was your major when you started?
When I started off, I was PT track. I was physical therapy.
Okay.
Physical therapy for exercise science, but I kind of wanted to steer in a different direction. Growing up with sports all my life, I've grown up throughout high school and stuff like that, and I've more leaned towards athletic training. And when this program came about, this was huge for me. I thought about it, and I've talked to plenty of people, family members, people here. Dr. Wallace herself being a huge inspiration for me, wanting to join the athletic training program. So that was just huge for me to even get into this program.
What was Dr. Wallace who kind of helped you to make that final decision, as to her influence, if I'm correct, made you decide, I think I want to go athletic trainer, not physical therapy, right?
Yeah, absolutely. And in fact, I also play a sport here, playing baseball here, growing up with the athletic trainers and seeing athletic trainers, being in the athletic training room quite a few times for little tweaks here and there. I've gotten a little bit of a taste of what it's like to be an athletic trainer here, but then Dr. Wallace herself was just, having her in class, she was a great inspiration for me to want to join this program. So I was like, you know what, let's go ahead. It's about time I need to decide to change out of PT and become an athletic trainer. So
now, you were redshirted in baseball your first year, correct?
Yeah, my first year at YSU, I was redshirted. I was actually a walk-on here at YSU. I was never a scholarship athlete to start, and so when that came about and they redshirted me, I took advantage of it my last year here, even though I'm in the master's program here. Took advantage of playing this last year as a senior.
And then I like where you want to go. You want to go in the direction of some form of professional baseball.
That's the goal, absolutely. I would love to go and further my career, not necessarily maybe even playing in the majors, but being a part of that atmosphere and being there as an athletic trainer, hopefully one day after I finish this master's program, and seeing where it takes me.
So when you become an athletic trainer for one of the major leagues, you're not going to forget us, right?
No, absolutely not. Absolutely not. I could never do that. Growing up here, born and raised, like I said, been here all my life, so I could never forget about this place.
All right. I want to interview you again when you're working in the professional baseball world.
Well, hopefully I can get there one day, so that'll happen.
So we cannot have a fabulous show about athletic training at YSU without the head athletic trainer at YSU. Welcome, Mr. John Doneyko.
Thank you, ma'am.
And you have been an invaluable source of information for me in learning a little bit about this whole area.
Thanks.
But I want you to tell us about your background. You've been here 30 plus years.
I'm just starting my 31st season as an athletic trainer at Youngstown State. When I started, it was Dan Waffen and I we had a staff of two. And I worked mostly over in Beagley with the sports that happened out of there: men's basketball, women's basketball, volleyball, swimming. And now I'm the head athletic trainer stationed over in the stadium. We have a staff of 6 certified athletic trainers, and we just added 5 certified graduate assistants. And now the master's kids too.
And I know you a little bit, but then also your staff was involved in the creation of this program.
Martha Dettel, who's one of our assistant athletic trainers, was really instrumental in taking the lead in helping HPES develop some curriculum and some guidelines for the Masters of Athletic Training program.
Tell us what it's like a day in an athletic trainer's life.
A day in the life of an athletic trainer. It really depends on sport, what time of year it is. For instance, now I'm working football, so I get here about 7:15 in the morning. We do football treatments in the morning, so I can give the coaches a report on each particular player's status for the day, so they can plan their practice schedule and make doctor's appointments for the injured athletes, take people to the doctor, have our doctor schedule here sometimes. Then afternoon is usually devoted to rehab. Well, the student athletes come in between classes, do their exercises, do additional treatments here in the athletic training room. Then we cover practice. After practice, which usually lasts about 2.5 or 3 hours, we come back here, do another round of treatments, clean up, go home, start it all again the next day.
You touch many, many lives. You touch the athlete, you touch the physician, you touch the coach, I'm assuming you touch the parents, you touch a multitude of people in your role. Talk a little bit about how that all comes together.
Here, the model at Youngstown State has always been the athletic trainer has been the gatekeeper. So before somebody goes to the doctor or to the emergency room, they see the athletic trainer who's assigned to their team, and then we make a team approach to what's going to happen. We will call one of our team physicians. We have a staff of 3 team physicians, a chiropractor, some dentists on staff. So we try to handle their referrals. We talk to them probably on a daily basis. We have contacts at the imaging centers in the area if we need to get an MRI or a CAT scan or somebody. We have those relationships that we build. Now more than in the past, we have a lot of interaction with parents because of insurance requirements, and they want to know how their children are participating, doing, healing, and obviously coaches. And then the student athlete themselves wants nowadays to understand what's going on, what the process is, why did it happen, how did it happen, what can I expect going forward, when will I be ready to participate again with my team.
Athletic training involves, because I always thought about it, okay, you're injured, go see the athletic trainer first. I have now learned it is prevention.
Yes.
If you do get injured, assessment, immediate care, you're first on usually wherever the sport is being played.
Right.
You're the first to respond. Then you get involved in the rehabilitation, working with the medical staff or the medical team of the individual, and as well as the treatment, correct?
Correct.
The athletic trainer is recognized by the American Medical Association as an allied health professional field, correct?
Yes.
What type of certifications do you get after licensure after you complete your studies?
We take a certification test that's administered by the National Athletic Trainers Association Board of Certification. We successfully complete that. We are considered certified athletic trainers. There's a 2-year continuing education cycle. I don't, off the top of my head, can tell you the number of hours, but 50 hours every 2 years of continuing education.
That much?
Yeah. And then also in Ohio, we're required to hold a license to practice athletic training.
Wow, that's very impressive. Proper use of equipment. I didn't realize, because I would think of going to a personal trainer for that. One of your roles is to actually teach the athletes how to use, I'm assuming, weight equipment or whatever they're doing, use equipment properly.
Yes, whether it's weight equipment or rubber bands or body position for isometric or body weight exercises. Range of motion is very, very important, so we're there instructing proper technique also.
So in closing, what advice do we give our audience? What advice do we give these students that are entering this new grad major?
I think athletic training is a very gratifying field. It's a helping profession, starting to be recognized as an allied health profession. More and more people are getting involved, more relationships are being built, and I think society is figuring out that sports, regardless of what they are difficult, and we need somebody there at the forefront to help people get through it, whether they're hurt, whether they don't want to be hurt, or whether they want to just reach their full potential.
Thank you so much for
You're
joining
welcome.
us. I appreciate it. I now welcome Mark Dell, another student in the program. And this must be the students from Hubbard. You're from Hubbard as well.
Yeah.
Did you go to school with Ryan?
I graduated a little bit before Ryan. I've
Okay.
been going to school for a while now, so I do not know him, but he has friends that I know, and I have friends that he knows, so everybody knows everybody in Hubbard. So
Yeah, exactly.
It's a
The
good-
small
it's a good thing,
communities of Youngstown.
Definitely.
Tell us how you ended up at YSU.
It was kind of, I heard Ryan talking earlier, kind of the same deal, right down the street, and I wanted a really high quality, affordable education. So I came to YSU. I've changed my major a couple times, but now I'm in what I love to do. So, it's been a great journey, and I've learned a lot along the way.
What was your undergrad in?
My undergrad I graduated with is exercise science.
And strength and training, I think, was your focus, if I remember.
Yeah, it was at first my focus. I wanted to get into strength and conditioning, and I did an internship at the end of my undergrad, and it was split between strength and conditioning and athletic training. And just having that experience made me go more towards athletic training.
You did an internship with basketball.
Yes, the men's basketball team here at YSU.
How was that?
It was awesome. I love being around athletes. That's why I love doing this. It's a big reason a lot of people get into athletic training. I just love being a part of athletics.
And I love your passion for what you want to do when you complete this program. Tell us what you want to do, because and I'm hoping you want to stay in our community.
Yes, definitely. I really love high school sports, specifically high school football. You know, it's just the feeling you get when you're under the lights Friday night, and you know, being part of it was awesome, and also going back and you know, helping athletes, high school athletes, just as good as playing on Friday night. And that's what I love to do, yeah.
And you know, it's great to have wonderful talent to stay and, you know,
yeah, definitely.
Stay here and continue to thrive here. So I want to interview again in a couple of years when
definitely,
you're, and see how it's going.
Awesome.
All right, thank you, Mark.
Thank you.
We appreciate it.
Thank you.
So as we come to our final segment of this amazing show, I wanted to say thank you to my very dear friend, and I couldn't have pulled this all together without you, Coach B, Bob Mansfield. Thank you so much for putting it all together with me. Like I said, I couldn't have done it without you.
I really believe you're being very kind. I was glad to have the opportunity to see President Tressel here. I've spent a lot of time with him here at Youngstown and in Ohio State, and see JD, who I've known when I was back here in my days at Youngstown State, and actually the facility here has just improved dramatically, and the treatment these athletes get is just top shelf.
And to remind the audience, you were a part of this YSU athletic team when President Tressel was Coach Tressel, correct? So you really understand this whole perspective.
Well, I was a small part of it from the academic standpoint of it, but that was a great run, and Coach Tressel was here for 15 years, and this facility was here, but
and put YSU on the map.
Put YSU on the map, and I think that Coach Pelini will do the same. But this facility here was not like this when I was here. It's been improved 100%, and these student athletes should be very appreciative of what they have here.
Coach B, thank you so much again. I really appreciate it. And to our audience, I hope you enjoyed this show. YSU is just an amazing campus. If you have an opportunity, please come visit. And this is Fit for You. I'm Mary Pepino.